Hi, I'm Dr. Robert Berja. I'm a board-certified dermatologist and fellowship-trained cosmetic dermatologic surgeon under the guidance of Dr. Robert Weiss. Over the past year, I had the opportunity of taking part in the clinical trials for the Potenza RF microneedling device and the pleasure of treating dozens of patients. Today, I'll walk you through several treatments targeting areas such as the face, neck, abdomen, and upper thighs, and discuss proper treatment techniques and settings. Our patient here, she is unhappy with the appearance of her abdomen, and we will focus on tightening the tissue through soft tissue coagulation. First step will be to cleanse the area with an alcohol wipe, and just to make sure there's no makeup or anything on the skin, whether it be on the face or on the abdomen. Before applying the numbing, we will designate the area that we want to treat, and we will just mark that with 4 marks here. And we can apply the topical numbing. This is a topical BLT to the area. So we'll let that sit for approximately 30 minutes until the patient is well numbed in the area, and we will then clean it off with some more alcohol or acetone, or also hypochlorous acid is another good option, and then we can begin our treatment. The area that you want to treat, try to limit it to under 200 centimeters squared to prevent any type of cardiotoxicity or systemic absorption. When selecting the proper patient for the device, we found that patients with mild to moderate laxity were great candidates, as well as those with mild to moderate blemishes and mild to moderate textural changes. Additionally, our younger patients tend to have thicker and more hydrated skin and respond better to treatments. For our patient today, we've chosen to use the S49 needle, offering a semi-insulation with 2 areas where radiofrequency is able to heat the skin, offering greater benefit to the patient with fewer passes. Although the tip comes sterile, the overall procedure is clean. And to attach the tip, you just open it out of this sterile container, place it on the handpiece, and twist. It's now been about 30 minutes, and it's time for the numbing medication to be removed. From here, we'll further clean the area with another alcohol wipe. Now that our patient is cleaned and wiped off with alcohol, it's time to start treatment, which will start with a test spot. Typically, we will test the areas using a high wattage with a short pulse duration. Some patients find that more comfortable. Others prefer a lower wattage with a longer pulse duration. As you can see here, I have a NEM pad, which is required for monopolar treatments. For any abdominal procedures, we recommend placing the pad on the lower back, and anything on the face or the neck, placing the NEM pad on the upper back. As you can see here, for our test spot, we chose a power of 20 watts with a pulse duration of 50 milliseconds. Additionally, we're using a 1 megahertz and monopolar setting, which is more comfortable for the patient, along with a needle depth of 3 millimeters. For this tip with 49 needles, we chose an impact factor of 6 to help the increased surface area of the needles enter the skin. When performing the treatment, it's important to keep the skin taut and insert the needle tips at a perpendicular angle to the skin. Some patients that may not respond well to treatments are postmenopausal females, as well as patients who are smokers. Some of the most common treatment areas are the forehead, crow's feet, under eye, upper and lower cheeks, upper and lower lip, neck, décolleté, and the abdomen. As you can see here from this first test pass, we are achieving the desired results with mild erythema and edema, as well as some minute pinpoint bleeding. When performing the treatments, patient feedback is always very important. Our patient today is comfortable with these settings, so we will continue with them. We recommend using these tips for skin tightening through tissue coagulation. And as I mentioned previously, you always want to keep the skin taut. When performing a treatment, it's always important to monitor the impedance. Because we're using the S-tip needles with the semi-insulated tips and a dense pass with 25% overlap, we are only required to perform one pass. Had we not overlapped, a second pass would be used. Overall, from start to finish, typical treatment times are 45 minutes or less, with the actual treatment taking under 10 minutes. Following the procedure, a ice pack can be used for patient comfort, and following treatment, patients are encouraged to use a mild cleanser to wash the area, and patients are also told to avoid using any retinoids or performing any type of exfoliation to the skin. For our next patient, we'll be performing a full face treatment. For this treatment, we'll be using two different tips. One will be the insulated 25 needle tip, and the second will be the semi-insulated 25 needle tip. For the upper part of the face, I chose the insulated 25 needle tip, which is safer for more delicate areas of the face, and it causes less risk of skin surface side effects. And before proceeding with the treatment, it's always best to start with a test spot, and on the face, the preauricular area is one of the best areas to treat. So for the first test spot, we will use a high power and a short pulse width. How'd that feel for you?
Good.
Okay. And this will be the second test spot at 6 watts and 150 milliseconds. Now that we've tested the two test spots, we can see what was more comfortable for the patient and proceed with the procedure. Once again, keeping the skin taut is important for the procedure, and you always want to go in completely perpendicular to the skin. For this procedure, a 4 out of 10 on the pain scale is the desired amount of pain that we want to be tolerable, and our patient has just rated herself at a 3 or 4 out of 10. As you can see, we're getting a good impedance rating with 276. I typically like to do the first pass going in a horizontal motion, and then for the second pass, I'll follow through with the vertical pass. So now that we're moving on to the forehead, we've decreased the needle depth due to the thinner skin on the forehead. As you can see, there's very little overlap, and with each full face pass, we're aiming for about 500 pulses. With each pulse, you can see a little bit of minimal pinpoint bleeding, some minute erythema and edema, which is exactly what we're looking for. Okay. And now we'll begin a second pass on the forehead. We've reduced the wattage and the depth of the needle slightly. As you can see here, there's a few areas that aren't not as erythematous as the others. To make sure I hit those areas, I'll go proceed with a vertical pass for the second pass here. And now as we move to the nose, we've increased the wattage slightly and increased the depth of the needles back up to 1.5 millimeters, since the skin is thicker here than on the forehead. As we move on to the upper lip, I will keep the same settings. This is in particularly one of the more sensitive areas to treat, along with the under eyes. And now we'll be performing the second pass on the upper lip. We've reduced the wattage and the needle depth. And one other helpful tip is to ask the patient to puff up their lips, and they can even push on the back of their lip with their tongue to increase the area to treat. And now we'll be performing our second pass of the cheeks. If you find yourself with leftover pulses, each tip has 1,000 pulses. You may want to do a third pass to hit certain target areas, such as around the eyes, the glabellar furrows, or around the mouth. As you can see, after the 2 full passes to the upper face, we have some slight pinpoint bleeding, mild erythema, and edema. For the lower part of the face, we've decided to use the semi-insulated 25 needle tip. We will use this with a monopolar setting at a depth of 2 millimeters to target the deeper dermis and cause tissue tightening through soft tissue coagulation. Once again, you can see my opposite hand, keeping the skin taut. Maybe a little more to your left. Perfect. Following the procedure, a ice pack can be used for patient comfort. And following treatment, patients are encouraged to use a mild cleanser to wash the area. And patients are also told to avoid using any retinoids or performing any type of exfoliation to the skin.